Hi everyone, my name is Ruth. Welcome to today's lesson. We are going to learn about chlamydia. I'm a student at Aga Khan University in Tanzania. Welcome. So what is chlamydia? Chlamydia is a sexually transmitted disease which is caused by a bacteria. It's actually most prevalent amongst the STDs. Now, chlamydia has very mild symptoms. Sometimes the symptoms cannot be seen, and that is why it's also known as the silent infection. Now, you can see that photo there. That photo there shows that 5 in 10 men who have chlamydia or who have been infected with chlamydia do not have any symptoms, and therefore it's also known as the silent infection. The effects of chlamydia when if it is left untreated. For example, in women, it causes pelvic inflammatory disease, in short PID. It can damage the fallopian tubes, and therefore if the fallopian tubes are damaged, it can cause infertility. It can also increase the risk of ectopic pregnancy, and so some people would be forced to abort their pregnancies because of chlamydia. In men, it can cause internal scarring of the genitals, and therefore due to that, it will lower the sperm count and hence a risk to infertility. So in both men and women, chlamydia can cause infertility. The symptoms of chlamydia in men are such as you can see a white, cloudy or watery discharge from the tip of the penis. And then there is also pain or discomfort or a burning sensation when urinating. Another symptom is that there is inflammation, tenderness or pain around the testicles. You can see in that picture there, that is where there is an inflammation. So there is a lot of pain and it feels like a burning sensation. Now in women, you will notice an abnormal vaginal discharge that may have an odor. Okay, it's normal for women to have discharge usually, but when it is accompanied by a bad smell, then that one becomes an abnormal. The color of the discharge can be white or yellow or greenish. You can see from that photo, that is the apant which has a discharge, so you can easily notice that discharge. Also, there is bleeding between periods, and also you can have painful periods. Another thing is that you can have pain when you're having sex, or you can have pain when you're urinating, and the area near the vagina will feel itchy, or there'll also be an inflammation. Now during this instance, I want to tell you that these symptoms, both in men and women, they are being shared across all the other STDs. So sometimes it might not be chlamydia per se, it could be another STD, it could be gonorrhea, it could be syphilis, or it can even be HIV. So it's always good to get tested. Now, chlamydia can be treated. Like I said, it has mild symptoms, but it can be treated through use of an antibiotic. So the antibiotic, you would have to go to a doctor, get tested, and then you'll be given an antibiotic that is prescribed by a doctor. How can one protect themselves from chlamydia? One, you have to use condoms always when you're having sex. It can be oral sex, vaginal or anal, any type of sex. When you have sex, make sure you're using condoms. Another way to protect yourself is that if you have a new sexual partner and you've just met, maybe you've never engaged in unprotected sex, it's high time you ask your partner and yourself to get tested before you engage in unprotected sex. Just before we wind up our lesson, I just want to give you a word of caution that if you have engaged recently in unprotected sex, it would be better for you to seek medical advice. Once you seek medical advice, you can be treated. And these diseases, they have treatment, especially at early stages. They might not have any effects. So that marks the end of our lesson for today. Thank you and stay safe.